Let's talk about your pelvic floor. If you are here, it most likely means that you have been diagnosed with a pelvic floor dysfunction, or you've been told that you need to work on your pelvic floor. Maybe you've recently had a baby. Maybe you have a recent hysterectomy. Wherever you are, this is a great place to learn a little bit about your pelvic floor, and I'm going to give you 3 exercises to do every day to help you address those dysfunctions. So I'm going to talk to you for just a minute, but I'm going to jump into those 3 exercises too. I just think it's really important as a physical therapist, as someone who has suffered through pelvic floor dysfunction myself, it's important to understand what's going on. So I'm going to have you sit cross-legged. So you can sit in a chair for these. If you need to, you can sit up on a block, but I just want you to find a comfortable seat. And we're going to talk about your pelvic floor and how to do that famous Kegel exercise. So what we're going to do is call it a pelvic floor contraction, okay? And I want you to think about your pelvic floor sitting here almost like a trampoline. So it's moving, it's going from your pubic bone back to your tailbone, and then from side to side as well. So it's nice and think of it as flat there, but it should be nice and elastic. So we're going to help pull that elastic up, because what tends to happen is it gets really loose and we need to help contract it. But we're not going to think of a Kegel. I'm going to give you some other cues here that are really important, but you have to be willing to hear the anatomy as well, okay? So I'm going to use the words of what we're working and just work with me here. So I want you to think about taking a deep breath in and then exhale. On the next one, we're going to contract on the exhale. And what I want you to think about is that you are drawing your pubic bone back toward, your pubic bone back towards your vagina. Okay, so when you exhale, that's what you're thinking about doing. Draw your pubic bone in the front here back towards your vagina. Okay, so take an inhale. Exhale. Pull it in. Good job. Inhale, relax. That's just as important. So you inhale, relax. Exhale, draw it in again. So you want to try to hold it for the full exhale, and then you're going to inhale and relax. Right? Do one more. Inhale. Exhale, draw it in, and then relax. So now that was the front part of the pelvic floor musculature. We need to work the back part as well. So I want you to think about your tailbone. If it helps, you can think about your anus. That's where we're working, is back there, okay? So take an inhale. Exhale, now draw from your tailbone towards your vagina. And then inhale, relax. That should feel just a little bit different, okay? So you relax on your inhale. Exhale, gently draw it in. So now we're going from the back forward. If this doesn't make sense to you yet, that's okay. I just want you to keep practicing, keep practicing, keep practicing. We are slowly building the muscle connection from your brain to the musculature, all right? Now, final piece to this. Don't skip this part. What you're gonna do is draw them both in and up at the same time. So a good cue that works for a lot of people is you're gonna think about sitting on a bean, okay? A dried bean. And what we're gonna do is pull from the front and the back at the same time, and then you're gonna pull that bean up into your vagina. If it helps, you can think about sitting on a Kleenex and trying to pull that up and in, and then you relax and let it back out, okay? I know it might sound silly. You can laugh if you want, go ahead, but these cues work, okay? So inhale and exhale. Go ahead and draw it in again from front to back, and then pull it up. Gently pull that bean or that Kleenex up into your vagina, and then you relax it back out. All right, so do a few here as I'm talking to you. So you relax on the inhale, exhale, draw it in, pull it up, continue to pull and hold for that full exhale, and then relax when you're ready. This is much more effective than a typical Kegel exercise. That idea of stopping the flow of urine, it doesn't work. Research actually shows us that when women use that cue, they're not contracting the right muscles. So I want you to really work and practice on this one, okay? And if you are in a place that you are really trying to work and build your pelvic floor muscles, then you need to do 50 of these a day. So keep coming back here to see me if you need to, at least for 30 days. That's your homework, to do this video for 30 days every day. And you're gonna do 50 of these a day. You can do them laying down in bed. You can do them sitting in the car, sitting at your desk. You can do them laying on your stomach, reading books to your kids. That's what I do half the time, okay? Just make sure you do them. So that's homework 1. Homework 2 now, we need to work fast twitch fibers in the same area. So this is what that means. You're gonna take an inhale. Exhale, you are gonna do 5 of those contractions as quick as you can. Release, quick, release, quick, release, okay? Quick, release, quick, release, and rest. And you might be like, what in the world did you just do? It's okay, we need these fibers too, so do it again. What you're gonna do is you're gonna pull it in, what we just did, that contraction, right? You pull it in and up, so you suck that bean in and up, relax the whole thing. Do it again right away, relax the whole thing. You're trying though not to tense all the other muscles in your body when you do it. So it's just as important to learn to relax as it is to tighten. So the difference is doing those long sustained contractions are gonna help your pelvic floor during regular activity during the day. These quick ones, that's gonna help like your incontinence. So if you leak urine a little bit when you jump, when you run, that's what this helps with, all right? And I want you to try to do 50 of those during the day. If it sounds like a lot, I know, just do as many as you can, okay? I promise it will make a difference. All right, so we're gonna move on to homework number 2, now that you understand those 2 different pelvic floor contractions that are really important. The next thing, and you might think this has nothing to do with your pelvic floor, I promise you it does, and it's super important. Sit with your legs out in front of you. Have your legs about mat distance or shoulder distance apart. Pull your toes back towards you. So what happens when the pelvic floor has a dysfunction is we also tend to lose all this space up in our abdominal canister, and we lose movement up in our thoracic spine. Research shows there's a direct connection from our thoracic spine to our pelvic floor. So we're gonna move that thoracic spine. Hands behind your head, elbows wide. So you're gonna sit up as tall as you can, and then maybe find that pelvic floor contraction here. And now rotate to your right, center, left, center, okay? So again, you're kind of thinking about drawing that bean up and in, and then you're trying to get that upper spine moving. So don't be surprised if you feel tight in this position. Like you might feel tight in your hips, you might feel tight in your back. But again, think about sitting up as tall as you can and trying to lift the pelvic floor, even as you're kind of trying to lift your ribs up off of your hips. All right, one more to each side. Last one. Nice job. Hands come down. And then lay down on your back. Okay, this is gonna be our last thing. So feet are gonna be hip distance apart. Arms relax at your sides. Take your inhale. Now exhale, curl your tailbone, roll yourself up, 1 vertebrae at a time. Okay, inhale at the top, draw that pelvic floor in. Exhale, roll back down. So what we're trying to do now, inhale at the bottom, exhale to do the same thing again. We're trying to get the spine moving. Okay, I just had you do some rotation for the spine. Now we are trying to articulate inflection and this natural movement. And what happens is when there's a dysfunction, we kind of lose that. We either really guard in our pelvis, things get tight, so we want to try to move. And it's also a nice place to make the pelvic floor feel better because you're de-weighting it, meaning when you roll up into that bridge, you're up against gravity, right? So there's not any weight down on the pelvic floor. Nice job. So here too, you can pull in on the pelvic floor when you exhale. You can inhale, release it. Exhale to roll down. What I really want you to focus on though is that moving through the spine. Okay, just one more of these. Nice job. So that was about 10. Okay, so you can roll to your side and sit up, and I'm going to review all of that. So if you are having pelvic floor issues, if you've been told you need to help strengthen, if you've recently had a baby, if you've recently had a hysterectomy, you can start all of these. You want to do it every day for at least 30 days. So just keep coming back to see me. I promise it will make a difference. You want to try to do those pelvic floor contractions 50 times a day if you can. That's just your goal. If you don't reach it, it's okay. Just think about trying to do it and then go through these other exercises as well. I'm going to leave a lot of resources below. I have a full prolapse guide. I have many hysterectomy exercises as well. I have been through this. I know what it feels like, and you can get better. I promise. All right. I'll see you next time. Thanks so much for stopping by. Remember, subscribe to my channel and you'll be notified every time a new video comes up. Like and comment on this video and let me know what you thought. You can also always come over to jessicavalantpilates.com to find all the resources I have for living a healthy lifestyle, including full-length workout videos, healthy recipes, and a community I would love for you to be a part of. So I'll see you there.